Sister Jones. How are you today? My name is Casey. I'm going to be your nurse for today. I'm going to perform some hand hygiene and apply clean gloves. And I will pull this curtain too and provide us some privacy. Can you verify your name and date of birth for me? Perfect. Do you have any allergies? No. Good. Are you in any sort of pain today? No. Perfect. So what I'm going to be doing is I'm going to be inserting a Foley catheter to make it a little easier for you to void, okay? So first things first, what I'm going to do is I'm going to go ahead and roll your sheet down. And she's already in the proper positioning, dorsal recumbent. And I'm going to pull her gown up and we're just going to get her washed. So I'm going to remove my towel. We have some warm soapy water here. I'm just going to dip my wash rag in here, clean from top to bottom, dip again, wring that out, flip it over, top to bottom, dip, bring it out, flip it over, and then top to bottom again down the middle. And then the next thing I will do is dry her off. I will take my towel and just follow the same motions. Top to bottom, flip, top to bottom on the side, flip, top to bottom down the middle. And then since we have her all cleaned up, I'm going to go ahead and set that to the side, remove my gloves, perform more hand hygiene. Then the next thing I'm going to do is get her catheter kit set up. Take her kit, place it in the bed, and then open it up, ensuring to only touch 1 inch around the margin of the drape. And I'm going to go ahead and remove my sterile gloves. Get this out of my way. I'll open these up, ensuring again to only touch 1 inch around the borders of my sterile field, and I will glove my dominant hand first. Now I will take my 2 fingers and slide it into my non-dominant hand glove. And then I will ensure proper fit. The next thing I will do is I will take my drape, open it up, ensuring to only touch again 1 inch around the border. And I will take it shiny side down, wrap it, tuck it under my patient, ensuring not to touch my patient. And then the next thing I will do is open up my next drape, and I will place it over my patient, ensuring not to touch my patient and only the drape. I will go ahead and I'm going to scoot my kit forward and remove what I need out of my kit. I'm going to place some sterile lubricant into my kit, and I will take my syringe and attach it to my green port, and then I will take the end of my catheter, place it in my lubricant. The next thing I will do is I will take my swab sticks, I will open them up, and then I will take my non-dominant hand, which will no longer be sterile. I will open up the vagina and I will clean top to bottom, discard, a new swab, top to bottom, discard, and I would get a new swab, and then I would clean down the middle, top to bottom, discard. And I would not take my hand off like I just did. I would discard that. The next thing I would do is I would take with my right hand, which is still sterile, my catheter out of my lubricant. I will tell my patient to take a deep breath, and I will insert the catheter in about 2 inches. And then I will insert 5 cc's of saline into the balloon. Ensure that it's in, and then I will remove this, and I will hang my bag and my gloves are no longer sterile. I will remove my sterile gloves, perform hand hygiene, and then apply clean gloves because I'm going to take a urine sample now. I will tape them first. I would still have my sterile gloves on. And I would tape to the leg with my sterile gloves still on that I've already taken off. Tape that down. And then apply one more piece of tape, and then I would have hung the bag and taken my sterile gloves off. Now I will apply more gloves and take a urine sample. Perform hand hygiene, put clean gloves on. I will drain my urine bag. Drain it, ensure that it doesn't come off the hook. Make sure that the valve is closed. We'll clamp this off. Wait 20 to 30 minutes and come back. Take my syringe, put it into my blue port, withdraw 10 cc's of urine, open up my specimen container, place the urine in, close my container back up, and then I will label my container with the my initials, date, and the time. I will unclamp this to ensure that my patient can still properly void. And then I would remove my gloves, perform more hand hygiene, and then I would apply clean gloves because I'm going to now remove my catheter. So the next thing I will do is I will ensure that my urine bag is drained again. Ensure that it is completely drained. Put this back. Remove the tape from my patient, and I would use some adhesive remover if I needed. I'll take my syringe and I'm going to withdraw the saline that is in the balloon. And I would tell her to take a deep breath, and I will slowly remove the catheter. And then once my catheter is removed, I will check the patency of the catheter, and I will still ensure that the catheter is still intact. And then I would clean my patient, cover her back up, and then perform our hand hygiene and leave the room.